Welcome back, everybody. And continuing with our health topics today, our next guest has received her share of publicity. She is one of the very few doctors in the country to do a procedure called LVR, and everybody's waiting to find out what LVR is. It's laser vaginal rejuvenation. Please welcome Dr. Troy Hailparn and Francis, Feria. Yes. Thank you so much for being here.
Welcome.
Both of you for being here.
You're very welcome.
Tell everybody about LVR.
Well, laser vaginal rejuvenation, LVR, is a procedure that tightens the vagina. Women who've had children notice a change in sensation with intercourse, or they may notice some leakage of urine with intercourse, or with coughing and sneezing and picking up something heavy. And this can support the structures in the pelvis as well as enhance sexual gratification for both partners.
Now, how did you get into this procedure? How did this all happen for you?
Well, I've been doing vaginal surgery for the last 11 years. I've been in practice here in San Antonio, and I wanted to add something to my practice that I felt was lacking. Women were coming and talking to me about more intimate sexual issues that were not necessarily being addressed as well by their other gynecologists. And I found that there was a need for labiaplasty, labia reduction, as well as talking to women about enhancing their sexual experience with their partners.
So this is something that women have been talking about, have been asking about, but nobody's been paying attention to them.
The other thing is a lot of women don't realize that these procedures are available to them. Their doctors may say, oh, it's just a little stress incontinence, or these are normal changes that occur after childbirth and you have to live with them, or your genitals are normal in appearance. Well, they may be normal, but it doesn't mean that they're comfortable or that they like how they look.
I see. Okay, wonderful. Well, thank you. We also have Francis, who's joining us, and you had the procedure done.
Yes.
And how did you find Dr. Troy?
By TV show.
Okay, but you found another TV show, and,
Yes.
and you wanted to have the procedure done just for your own person?
Yes, for my own person, yes.
Okay.
I'm very happy about it. And
what were your apprehensions going into it in a way? I mean, can you talk about maybe about the prep process, you know, obviously talking and really explaining it to you, and tell us a little bit about that.
Oh, well, when I went to the office doctor and I just go in and we talk about it and I just do that procedure, and I'm very happy about everything.
And do you find women are coming to you more often than not? I would imagine that women would be embarrassed at some point. So do you find that apprehension when women are coming into your office?
I do. I find women have been embarrassed as well as not aware. And part of it is, you know, talking to male gynecologists about your sexual intimacy problems is difficult. The older generation are not comfortable discussing that aspect. And again, a lot of the times practices are so busy now that they're not really taking the time to address all of the issues. They come in, here's your problem, let's fix the problem, but to look at the whole person and see how to fix it. And
how do you go about the procedure? Because you do it, there's three different types of women that are coming to you. Is that
well,
right?
There's three groups of procedures that are done. First of all, the laser is a 1-hour outpatient procedure, and the benefit to the laser over the scalpel is that it's a bloodless procedure. Instead of losing a quarter to a half a cup of blood, you can lose a teaspoon to a tablespoon of blood, which makes it a quicker recovery time, lower risk for infection, faster healing, and women do very, very well because they can come in and go out at their own, you know, discretion.
Sure.
But the laser vaginal rejuvenation procedure tightens the vagina and can fix the stress urinary incontinence. Then there's the labia reduction, which is done for either large tissue or uneven or pigmented edges. Some women have a lot of discomfort with certain athletics or riding a bike or even with intercourse. The labia can get pushed in and out and cause pain. Also, certain fashions don't allow you to wear those really tight clothes, and women can be very self-conscious. So not being aware that there's something that can be done to help both the look and the function and the feel is really a good thing.
Dr. Hale, oh sorry, keep going.
I was going to say the third procedure is hymenoplasty, and that's reconstruction of the hymen. With intercourse or sports or tampon use, the hymen can be disrupted, and we are recreating the hymen for women for certain situations. If a woman's been abused and it's been taken from her and she wants to choose to give it to whom she would like, she can have it reconstructed. For a woman who's been in a relationship for a long time and wants to give that virgin again experience to her partner, maybe she wasn't a virgin when she got married. And there's a small group of women of Middle Eastern descent or Asian who are at great risk, their lives are at risk if they don't have an intact hymen on their wedding night, and they're actually taken to a gynecologist of their in-laws' choice and examined, and they can be ostracized or exiled, so their lives are truly at stake if they don't have an intact hymen. Sure. So those three procedures, the labia reduction, the tightening of the vagina, and the hymenoplasty are the things that can be performed with the laser.
What is the recovery-like process, and does it vary on the person, maybe their physical fitness level on recovery? Can you talk a little bit about that, how long it takes to sort of feel like yourself again?
Sure. Most women actually are back at work within a week.
Oh, wow.
Okay, you'll feel like you had a baby afterwards, your bottom will be sore, you'll be sitting on a donut cushion and some ice packs and your Motrin, but most people are back at work within a week, and by 2 weeks, 90% back to full function, with the only limitations being nothing in the vagina, and if you had the tightening procedure, no heavy lifting for about 4 to 6 weeks.
And are people going to notice a huge difference right away?
A significant difference. If you have leakage of urine, you'll notice within 2 days you're not leaking as much, or it's completely resolved. If you had a lot of pelvic pressure or discomfort, that should be resolved as well. If the labia were bothering you, you look, they're gone, or they're markedly smaller. That makes a significant difference. And women, really, the next day, within 2 days, people are saying they feel significantly improved.
Okay, well, wonderful. It's a very intimate topic, of course, for most women out there. So thank you so much for coming in here and talking so candidly about it. And thank you, of course, for